Maternal Community Development Corporation's third Wednesday Parent Chat. My name is Loretta Miller, and I am working with Oak Hill as the Social Services Coordinator. I am a Medicaid CHIP, a sister for Oak Hill CDC, which is the parent corporation for Healthy Kids Mississippi. I'll be your moderator along with Sister Patina today. Hopefully we have with us one of our fearless leaders, Sister Lottie Miner, who is our project director. Sister Miner. Additionally, Mr. Thomas Rogers, our technology and metrics director, assisting us with technology. Duke, you want to say hello?
Good morning, everyone. Thanks for joining in to this edition of the Third Parent Resource Chat. We have Dr. Graves with us, and I know she's gonna speak good about the sickle cell awareness. So thanks for joining, everybody.
Thank you. In addition, we recognize, hey, Miss Brenda, our board chair, Jennifer Garrett, and our executive director, Dr. Michael O. Miner. I also want to thank Sister Bettina for this opportunity. I want to thank Pat Boga and Mary Fenner for helping us put this session together. Okay, we're restreaming live. Well, I'll get it right. We are restreaming live on our Oak Hill Regional CDC page and Healthy Kids. So feel free to share on your social media pages as well. Okay. We have as our guest, Dr. Patricia Adams Graves. Welcome. She's going to share with us on sickle cell, since this is our awareness for the month. She is an amazing woman, we see. Professor Emeritus with the Memphis and Hematology at the University of Tennessee Health Center. So from 1993 to 2009, she was the medical director for Diggs Krause Sickle Cell Center. That's one of the nation's oldest centers for sickle cell, which was founded in 1929, dedicated to the study of sickle cell disease. She earned a BS in biology and medical technology from Tennessee State. Go Tigers! She obtained her medical degree from the University of Louisville in Kentucky. She has remained for an additional 3 years with internal medicine residency. Okay. She continued her medical training, completing a hematology and oncology fellowship at UT in Memphis, and she has participated with Veterans Hospital, Baptist Hospital, helping those that, especially the ones that are living with sickle cell disease. The National Institutes of Health has selected her as to serve on many national boards, and she has chaired research sessions, local, regional, and national sickle cell meetings. Dr. Graves, it's all yours.
Thank you so much for that introduction, and thanks to the committee and your program for inviting me. I have to disclose that I actually have sickle cell in my family, a lot of trait, so I take it to heart. I also now am the chairman of the board of directors for the Sickle Cell Foundation of Tennessee that serves the Mid-South and bordering Mississippi and Arkansas for social services, which is now what is I'm doing advocacy while I still teach. I have retired as of July 4th from patient care. So I just wanted to disclose that so no one thinks they're going to find me to be a provider. Also, my husband is from Forest, Mississippi. So I lived in Jackson, Mississippi, the first couple of years of our marriage back in 1977 and 1978. So I thought I would disclose a few things. Now I would like to get into the presentation concerning sickle cell education. And I want to make sure that you can see the screen, and hopefully they can with the Facebook Live and the webinar. So the screen is clear? Okay, good. So what is sickle cell disease, and what are the unmet needs and the lack of awareness? And I think today you guys are bringing it to the light by making sure that we put forth awareness for the community. And I'm loving it. Uh-oh. Does somebody have to drive this for me, or I can't move the slide? Let's see. Okay. Now, this is a video, and I want you to keep an open mind. The video is just an introduction to sickle cell and how it affects the body. Can you see it, and can you hear it?
Just a single point mutation in the beta globin gene leads to the debilitating damage of sickle cell disease. This inherited change drives a complex, unrelenting condition characterized by vaso-occlusion, chronic hemolysis, and chronic anemia. Hemoglobin S polymerization is the root cause of sickle cell disease pathology and its long-term sequelae. In low oxygen environments, hemoglobin S molecules coalesce and begin to polymerize. The polymers coalesce into long fibers that distort red blood cells into the characteristic sickle shape. Hemoglobin S polymerization is the key event that leads to drastic changes in the integrity and function of red blood cells. The polymers deform red blood cell membrane structure, making the cells much more rigid and adhesive. This slows or obstructs blood flow, resulting in vaso-occlusion and diminished oxygen delivery. Lower local oxygen levels induce further sickling, vaso-occlusion, reperfusion injuries, and inflammatory responses. Additionally, membrane changes caused by hemoglobin S polymers lead to cellular dehydration, chronic hemolysis, and early cell death. Sickled cells only survive for about 10 to 20 days, versus 120 days for healthy red blood cells, which stresses the bone marrow and increases reticulocyte production. When red blood cells become fragile and lyse, they release hemoglobin and other cellular contents that contribute to vasculopathy and further inflammation. Free hemoglobin is broken down, decreasing the amount of active hemoglobin in circulation and leading to chronic anemia and its clinical complications. Left unchecked, the pathologic effects of vaso-occlusion, chronic hemolysis, and chronic anemia can lead to progressive tissue damage and end organ damage. Organs that may be affected by long-term chronic damage include the brain, eyes, lungs, heart, kidneys, and gallbladder. In summary, a single nucleic acid substitution in the beta globin gene causes hemoglobin S polymerization that initiates extensive pathological changes leading to vaso-occlusion, chronic hemolysis, and chronic anemia. There is an ongoing need for improved management of patients with sickle cell disease and related end organ damage.
Okay. So that was just showing you sort of inside the bloodstream of individuals living with sickle cell. And I hope that gave you an orientation so that we can move forward with this 2D kind of talk that sometimes is difficult to grasp. So let's start. 1 in every 365 African Americans, okay, live with sickle cell. And 1 in 9 African Americans are carriers of the gene, the trait. Among the 35.5 million African Americans in the USA, this is very important. There are only 100,000 living with the full-blown sickle cell disease. So I think that we think it's more common in America. There's millions and millions of sickle cell individuals in Africa, in the Mediterranean. But in America, we only have 100,000. And the definition of a rare blood disorder is less than 200,000. Leukemia is one of those. If you compare that to diabetes, heart disease, and cancer, these folk have a very quiet voice. There are not enough of us to fight. There are not enough families to get this out. So I'm loving every minute of sharing with you guys because of that. I've been the voice for about 35 years, and I am happy to continue to be the voice for free. So in the 1960s, this was considered a disease of childhood, and it was very much misunderstood. In the 70s, Diggs, for my predecessor who founded the first, what we call specialty clinic here in Memphis, Diggs Krause, it was estimated that people only lived to about 14 years of age. In the 90s, we did so much better. The pediatric group all over the country, St. Jude, all the other pediatric centers across the country, due to the good care, we have a growing population of adults now. So the median age is in the 40s, basically. And for a subtype, there's more than one type, they live in the 60s now. So we have, done good, but I would say there's still a 30-year gap in life expectancy. That's still not good enough. The average life expectancy for an African-American woman is about 80, and they live half as long. So here's how it's inherited. If you look at the top picture from Dr. Diggs, this is an old nostalgia picture. These two people are carriers that we talked about, 1 and 9. You carry 2 sets of genes, and each of these parents will pass along to their offspring 1 set. So if you look at this, white is normal. It's denoted as hemoglobin AA. So these 2 carriers can have about 25%. If they had 100 children, 25% would be normal. 50 of them would be like the parents, carriers, but 25 of them would be sickle cell. So the risk of having a child with sickle cell disease is 1 in 25 with each pregnancy. Now, here are the different severe types which are found in African Americans and Mediterraneans. What you need to know, there are more than 100 types of hemoglobin defects. And again, the defect is a genetic point mutation in sickle cell that causes all this havoc. They are born with this. The most severe type is hemoglobin SS and hemoglobin S beta thalassemia. The next, hemoglobin SC and hemoglobin S plus. So these 2 lower ones that you see at the bottom of the page live a little longer and have a milder course of disease. Here are the manifestations of sickle cell. In that video, one of the things that they showed were these 3 things, but it was hard kind of to pick up on it as is. So I'm here to kind of get you reoriented to what the video just showed you. The 3 major manifestations of sickle cell include the vascular occlusion, plugging up blood vessels with sticky sickle cells, which creates a tremendous amount of havoc. Anemia, and the inability to fight certain types of infection. Together, they walk around every day with this inflammation in their bodies that is making them feel terrible. And then when they're feeling at their best, they're still not feeling good like someone else that doesn't have sickle cell disease. So here is what happens when the sickling process occurs. That's the root cause. It ultimately can lead to organ damage. And if you look on that left panel here, you'll see the sickle cell with the hemoglobin, that purple, that's what is clumped up and sticky. I like to tell people that when you make sweet tea, we're in the South. So when you make sweet tea, think about this. You get unsweetened tea, and you try to sweeten it, you trying to get that grain in there and you stirring it up, some of it will dissolve. And then at a point, some of it will just settle to the bottom. That's how hemoglobin is in red cells. Red cells are like a bag of fluid, like a balloon full of fluid. And in there, you have that fallout of hemoglobin like you have with sweet tea sugar. Okay, you could taste it, but you can't see it. So you know it's there. And of course, in this, you can't see that. I mean, that's in your red blood cells. And even looking at a regular microscope, you will see the sickled cells, but you don't see the hemoglobin, okay, because it's dissolved within the cell. And if you look at that picture below that shows a picture of a blood vessel with the cells trying to flow, you'll see some of them are normal looking and some of them are sickled cells. Just think about this. Some of them are permanently sickled and some of them go in and out of being sickled. If they lose oxygen, they sickle. But if they pick oxygen back up, they'll turn around and start flowing again. Okay, so that process of that sticky and that hemoglobin clumping together like that, making that sickle shape is called polymerization. The next thing that happens is, again, these cells don't live long. They live about 2 weeks. Our cells live 120 days if you're normal, right? So that breakdown is called hemolysis, and that is where the bone marrow, the blood-making factory, has to replace those cells, and those cells are called reticulocytes or baby red blood cells. So anemia is that they don't have enough cells because of the destruction, the hemolysis. So they're anemic. The other thing is, again, to reiterate, blockages of blood flow. If you look at these sickle cells clumping up in there, you see that? I don't know if you can see my arrow. Can you see my pointer? Can you see the pointer? Oh, goody. That's a vessel which shows sickle cells plugging up blood vessels, interrupting blood flow, and it can happen at any time, unpredictably. They're sitting there minding their business in school. A child is sitting there, and all of a sudden that starts, and they got to go to the hospital because they're in severe pain and could be having other problems. So the first picture over here is when the sickling occurs. The second one, those cells are fragile, they break up. This is when they pick up oxygen again. However, all the cells are sickle cells, and then this plugging up of blood vessels. So too few cells, anemia, blocking blood cell blood flow causes havoc. Okay, so what are those symptoms again of anemia? Feeling weary, weak, tired, inability to do physical activity, difficulty thinking, so a kid with sickle cells in school, and they're always anemic. So they're sitting there pushing, trying to learn. And a lot of the teachers don't understand them because they're sitting there and you can't see the sickle cell. They just look normal on the outside, okay? But on the inside, you see all this stuff. The other thing about the hemolysis, when the cells break up, it releases a yellow pigment called bilirubin, so their eyes can be yellow. Teachers think they have an infection like hepatitis and they can spread it to other kids. So the education is very important for parents and teachers in the school system to know that these are kids living with sickle cell. They don't have an infection. They're born with this. So the impact is really great. And it impairs their ability to function like a otherwise normal kid. Here's a baby. These are some of our pictures from the Diggs collection way back in the day. He was a pathologist. This is a baby. If you look at this baby, of course, African-American, there's a little teardrop here. This baby, Dr. Diggs drew on this baby's belly. When the adult normal hemoglobin kicks in, which happens about 4 months of age, when they're born, they're carrying their mother's blood. And part of their blood is really called fetal hemoglobin. And that switches over between 4 and 6 months of age. And when that occurs, that baby's body says, this is not normal. And their liver and spleen tries to suck all those abnormal cells out of the bloodstream. This is a medical emergency. And this is called sequestration crisis. On the right panel here, that's the liver. and it's trying to filter out all those abnormal sickle cells at the switch. This baby's about 5 months old, and then the spleen also is doing the same. So this baby is like, it's kind of like internal bleeding. So this baby can die from profound anemia if this baby does not get a blood transfusion right away. Nowadays, this doesn't happen as much because, especially at St. Jude, they teach the parents how to palpate or feel for the organ enlargements on the baby's belly. Take them into the ER right away. Sometimes the baby will replenish the blood on their own, but oftentimes needs a blood transfusion to save the baby's life. This is some data. Don't get overwhelmed with it. This is just showing 4,000 sickle cell patients that were studied in the 70s. And you see it starts at birth all the way up to 48 months. And if you look at these things, babies' hands and feet and fingers will swell. That's called dactylitis. Dactylitis. And this is the baby sequestration crisis that occurs early. The incidence starts to go down and they're anemic all their life. But look at this. All of a sudden, the main manifestation of sickle cell is pain crisis. So let's look at the manifestation of infection. Infection occurs because the spleen shrinks down and is unable to filter out bacteria and viruses and all that stuff. So they have a reduced immunity. Okay, when they have a fever, we want them to go to the ER, especially if it's 101. So fever and blood infections and blood, it happens and it can be life-threatening. For a normal baby, oh, my baby got a cold, got a fever, blah. No, in sickle cell, a fever can mean danger, which could be crisis, what we call acute pulmonary event. If you look at this CAT scan of the lungs, this is lung. Lung looks black when it's normal. You see that? That's pus. Okay. And so this kills sickle cell in adult all across the spectrum. This is one that we always keep an eye on. So that child needs to be evaluated for this. Okay, anemia, pneumonia. Here's a cartoon showing blood infection. This is how an infection, these are red cells that can infect the blood. That needs IV antibiotics as well. And they can even have a bone infection, okay? So infection can kill. And it's important that individuals with sickle cell from birth on that have fever get evaluated right away. Okay, let's switch over to the anemia we just talked about. I think you understand they just don't have enough cells and they release those cells burst and release these products that are measurable in the ER that are looked at. That's all I'm gonna say. And I wanna go over sickle cell. Why the name sickle cell? Well, sickle cell is the name given to the population because a scientist saw the first, when the microscope was developed, saw that first patient with sickle cell disease. This kid, it's a picture. You see that right there? That's a sickle cell. Well, look at this. This is a sickle, which is a tool used to cut down weeds. And of course, African Americans had to use this to cut down cotton and clean out masses fields. So I would have called it Croissant's disease, but I think the sickle is more appropriate because we had to use it as a population to clean up the fields. We didn't have lawnmowers and all that back in the late 1800s. So this was a very important sharp tool. And Dr. Diggs just drew this on top of one of our patients' real blood smears. This is one of our patients' blood smears. This is how their blood looks. It's terrible. There's our baby. Here's those yellow eyes I talked about. That's called scleral icterus. It's a name for it, a medical name, but it's the bilirubin that you see here that's elevated, okay? That is measurable when they hit the ER. When that is increased tremendously, it can also mean that their liver is being plugged up with sickle cells. So it's very important that they get evaluated. The most common presentation I showed you in that data is pain, is the cardinal feature of sickle cell. And it's an unpredictable thing, but only, they're misunderstood as drug addicts and drug seeking, especially when they become adults. So a 13-year-old African-American boy that comes to the ER in pain is drug seeking and they're a drug addict because they're misunderstood. So only about 5 to 7, there are some sickle cell individuals that are drug addicts, but it's like the general population. So let's just focus on the 92% that are okay today. Now, what you need to know that pain can signal a life-threatening underlying complication that could kill them, which is that pneumonia called chest syndrome. They could be developing a stroke from plugging up blood vessels. Wherever there's blood flow, they can plug up the blood vessel. Sepsis or bacterial infection or acute organ damage, kidney failure suddenly. And these episodes, believe it or not, precedes 22% of sickle cell deaths. And even knowing that, me, and trying to educate my colleagues who are providers, they don't want to hear it. It's the bias. It's terrible. So I'm here to let you know that these folks are still being discriminated against. So most ERs make them sit out there because they look good, on the outside. You got this 21-year-old handsome Black man sitting there talking about, I need morphine. Go sit down until I can take care of these other people. And then they'll sit out there until almost death. So the waiting times are huge. And I've been on the battlefield to reduce that waiting time, to develop disease-specific medical homes, which we have done at the center that I worked at for 30 years. Here's Dr. Diggs showing, and this was a black and white, they had the color on top of it. This was in the 1900s, showing a young man with his nurse screaming and hollering and bent over in pain. All we had then was Tylenol with codeine, but he showed me, listen, he had a audio, and this was a fixed slide, and I would listen. Dr. Diggs actually died in his 90s and mentored me, thank God. And he would play this guy, and he would be like, and I just started crying. I said, that's enough. I'm done. Because I too was biased. Why are you giving all these people this pain medicine? Well, Dr. Diggs, he got my attention, and I'm hopefully getting your attention. So here are all the causes of pain in sickle cell. It's a laundry list. And since you're recording this, I'm not going to read all of this to you, but look at that. The acute or the sudden ones, and then you have stuff they live with every day, bone disease, arthritis, because their bones are destroyed. It is terrible. So vaso-occlusion, again, this is the old way. I showed you the video. It is havoc. It causes not only the pain, but it can also damage organs. That's brain showing a stroke. Below here is the lung vessel showing plugged up with sickle cells. These are biopsies. These are autopsies. Now, if a kid comes in with pneumonia, they also plugging up blood vessels. So it's complicated. You can't see this on chest x-ray. So I had a doctor one time call me and said, the oxygenation of your patient, she was 19 years old, Natalie. And oxygenation is pretty normal over 90, but if it's under 95 for sickle cell with chest syndrome and chest symptoms, that's abnormal. So he said, well, the oxygenation was 90% and the chest x-ray was clear. I'm sending her home. I said, no, you're not. You're not sending her anyway. And so he said, well, don't try to teach me nothing. He called me Pat because we're colleagues. And I said, well, I tell you what, if something happens to her, I'm gonna help sue you. And he's not even working in the emergency room anymore. But I've been like Muhammad Ali fighting for these folks. And of course, I've been the devil, the demon, and it was painful. But guess what? God showed me I was there for that purpose. He put me there for that purpose. So guess what? It wasn't about Dr. Adams Graves. So as long as I repeated that, this is not about you. Go for it. Protect, advocate. I survived. But if I hadn't made it about me with all those attacks on me, I would have been left sickle cell arena. But it's not about me. So I made it. Here's some other pictures. Skin vessels are plugged up, can cause leg ulcers that are painful. Here's hips. This is bone showing A, B, C, D. If you look at this hip bone, it's almost like a little mushroom. You could actually see it. And as you move down, see it gets raggedier and raggedier. Then they need hip replacements. This is a 15-year-old. And one of my sorority sisters, 15-year-old, is getting ready to have surgery over at St. Jude. So it's rough. Here's the liver we talked about. This is sickle cells plugging up the drainage system of the liver. They could go blind. Here's the eyeball showing blood vessels in the eye being plugged up, and the retina is being damaged. So they could go blind. So therapy includes for anemia, blood transfusions, folic acid, for pain medicine. So guess what? The opiate crisis was, that was a challenge. We had to stay on the line with the governor and the state trying to fight to make sure they got their pain medicine. And we won. They didn't get as much as they're used to getting, but hey, we won. But it took about 6 months of fighting to get them to release sickle cell as someone who is legitimately a painful syndrome. So we won. Infection, antibiotics, inflammation, anti-inflammatories, organ damage, whatever it takes. Blood exchanges, and blood dilutes out the sickle cell and reverses organ damage. So blood is life-saving for individuals with sickle cell. And when you get a lot of blood, they get iron overload, which can cause damage to the organs. So you have to treat that. It's pretty complex. Now, just to bring it home, sickle cell individuals are heavily transfused and rely on blood donations to stay alive. Locally, we transfuse over 100 pints of blood a month. Okay, so to your audience, becoming a blood donor can be life-saving. It's a needle, it's scary, but you have your own packet. There's no way to get an infection, but we match our own people better. I mean, I hate to tell you, but the majority, more than 70%, 75% of our donors are Caucasians. So when you see a truck or a blood donation coming, you can earmark it for sickle cell individuals. This was one of my projects when I was in training to get African-American donors, because there is some mismatching and blood is safer when you're within your race, for sure. So as the chairman of the board of directors of the Sickle Cell Foundation, visit our website. Here it is. I promise you, we educate. We have blood drives in various churches. We do trait testing. We do travel vouchers. We give food, Kroger gift cards if you qualify. And also, I hate to say this, we provide burial support, funeral support. So we need our donations. The other thing we have that's new, okay, the CEO and founder of our foundation lived with sickle cell and died. We've been scrambling the last 4 years trying to get it back. So as chairman, I was one of the mentors of Trevor, and I was an inaugural board member. Now I'm chair. We have a scholarship for high school seniors living with sickle cell disease that are college bound. But we also will provide it for those individuals, if qualified, to tech school. You know, you want to go to beauty school, 2-year certified school, we provide that scholarship for that. So if you want more information about those social services that we provide outside of the medical situation and the provider level, visit our website at www.sicklecelltn.org. So that is the presentation for today, and I'll open it up back to you for questions. If anyone has questions, I'm here to hopefully answer them. Thank you so much. And I'm gonna stop sharing, but you can put it back up if you want.
Yeah, we might go on back to some of those screens. Thank you, Dr. Adams Graves. That was most interesting. When you mentioned Trevor, that really touched my heart. I was a friend of Trevor's, and I remember that. Wow, good friend of mine, good friend of mine, good friend of mine. Great person, great person. So we've had a lot of great information. Are there any questions, Duke or Sister Bettina? We have any questions that we?
I'm checking the social media now.
Okay, good deal, good deal. We ask that you share our webinar on your social media pages. Okay, spread the information. I didn't realize that we only had 100,000 people in the United States that had sickle cell, but I have some people I know some people that have sickle cell. You know, one of the persons at my church was the poster child, Morgan. At my church was the poster child.
Morgan.
You know Morgan?
Didn't she got a transplant?
Yes, heard from her dad. And I think about that, a bone transplant.
She's been to our church.
Yes.
To speak. And I know her mom. I know her. Yeah.
Yes.
Great.
Yes.
We have a question in the chat.
Okay. What is the impact of sickle cell on those that have the sickle cell trait?
Well, first of all, I have a lot of trait in my family. Trait is a variant of normal. There are just a few complications that can occur. Say if you're mountain climbing, your trait still has a little less than half sickle cells in their body.
A little less than half.
Half normal cells and half sickle cells. The kidneys can be affected, but it's not very common. But basically, traits are in the Army and the armed services and do pretty good. There's very little, very few complications, and those complications are rare and few and far between. So if you're trait, the most important thing is that you can pass it along to your offspring. Mm-hmm. And your grandkids or your kids without the education and the counseling, genetic counseling, you can pass that gene along with your partner who also has a trait and produce a child with sickle cell. So that trait is what we call the carrier state. So you need to know your sickle status. If you don't know if you have trait and you're African American, go get tested. Go get tested. That's what I'm gonna say. Know your trait and educate your children before they start having babies. They be having babies when they're 15, 16 years old. Love does not work that way.
Yes.
So sexuality comes in, kids just, so you need to really educate them about that. If they know they're a trait, education.
And be careful who they choose.
Real careful.
Is stress or stressful situations, do they trigger a crisis into a sickle cell crisis?
I believe they do.
Okay.
It's like lupus. Lupus is one of those that stress can trigger things, but I believe they do, but it's hard to study that. But this is what we have observed. Extreme temperatures. So during the transition from fall to winter, their body, they don't like that super cold, jumping in the ocean, with a sudden change in body temperature, infection, which is a stressor. So cold, infection can trigger sickling. So there are various stressors. But now, when you say stress, like if you're upset, emotionally, that is hard to measure, but certainly all of us need to try to keep the stress down.
Right.
Period. Because stress can make you not want to eat, depression, all of those things go against health. So I truly believe stress can negatively impact individuals with sickle cell.
Right. Yes. Good question. So Pat, you have the trait. And I was told that sometimes the people that have the trait actually do go through some of the same things that people who have full-blown, sickle cell. They don't? They do? Yes?
No, not really. No. Too many traits out there. 1 in 9 African Americans, and we only see 100,000 with the symptoms. Now, can a trait have mild anemia and stuff like that? They
Okay,
can.
anemia.
They can, but for the most part, it's a variant of normal. You know, you can carry a gene for other kind of conditions and never have a symptom.
Never.
That's scary because you pass it along to your offspring.
Who don't know.
Mhm.
Right. Okay. This is a lot of great information. Do we have other questions?
No, ma'am. Not
I know it's getting close to the end of our session. It's 11:48. Sister Patina, this is great since it's Sickle Cell Awareness Month. You know, please visit the local, I think it's not called the blood bank anymore. Vibrant, what's the name of the new?
Vitalin.
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 Yes.
Yeah, they changed their name, but any of your hospitals can give you the name of your donor center. And if you want to arrange a blood drive at your church home, go to our website and talk to Mr. French, who is the new Trevor. He can set up your church home to get a truck to come out for donations.
To do blood donations.
And there are ways to do trait testing, you know, in your church home. So be sure to know that. We do them all the time. Greater Amani has quarterly blood drives, but since the COVID, the pandemic, we had to stop a lot of stuff. We're trying to get it cranked back up again.
Right. But Okay. So Sister Bettina, you want to do our announcements or close us out?
Thank you. Good morning, everyone. Thank you, Sister Loretta, for being able to step in for me. I'm happy that I was able to make most of it, but I was not sure. And so thank you. And at the last minute, talking about a 9th hour pitch hit, thank you, Dr. Adams Graves. What an awesome presentation. I'm sure that I wasn't the only someone that learned a lot about sickle cell. And I'm just grateful that you were able to help us. And I got that number in my hip pocket now, so don't think you're gonna get too far from us, okay? So again, we want to remind you that we have on Monday, October 29th, we have our 6 p.m. Ask Mary and Pat show. And they have a webinar where they're talking about Medicaid and how to access those health benefits. So just give them a call. And if you have questions, you can see their information here on the Zoom. You can call them at 662-298-3584 with any question with regard to Medicaid or CHIP. And these are the ladies that you want to talk to, talking about some awesome individuals with some wonderful knowledge. So please give them a call if you have any questions. And you can learn more about us on our Facebook page or website is www.oakhillregionalcdc.com and www.healthykidsms.org. So we ask that you stay with us and join us again next month on the 3rd Wednesday. We will have someone from the M.R. Davis South Haven Public Library who's going to talk to us about the wonderful services and opportunities that are offered through our first regional libraries in Mississippi. And you'd be surprised at all of the resources that they have that can help you and your families. It's not just about reading books. So please tune in at 11 a.m. on next 3rd Wednesday, and we will be talking about that. I want to again acknowledge Sister Loretta for stepping in at the 9th hour and helping me. And we also want to acknowledge our board chair, Jennifer Garrett, and our executive director, Dr. Michael O'Miner. This has been a production of Oak Hill Regional Community Development Corporation for belonging, building, and bridging in Mid-South regions and across the state of Mississippi. Thank you for joining us. Those of you who are on the Zoom, if you please stay on for a few minutes, and Duke, can you sign us off with Facebook and other